We have recorded deaths in areas that previously we had very few or none. Areas like Kuresoi North or South, we didn't have much of that, which simply means that the disease has really gone to the rural areas. To the rural areas where much of the older population is, and we consider that to be a major threat in our ongoing fight against COVID-19. We continue to offer all the necessary care for our COVID-confirmed cases. And as we all know, hospitals, especially our public hospitals, PGH, Naivasha, Molo, Gilgil, and all of them where we're offering these services, the persons who come to our services are not charged anything, which means that the burden of providing care to COVID-positive patients or COVID-sick patients is with the counties. We see this as a major challenge for counties because we need to continue procuring oxygen. We have to pay our staff. We have to make sure we have PPE. And noting that all national government hospitals from NTRH, Kenyatta National Hospital, KU, national government hospitals are charging, but county hospitals are not charging. So we therefore see a big danger ahead where hospitals will be unable to provide their services. And for Nakuru, we're in a unique situation because not only are we providing services to our people, we are also providing services to a larger population that comes from our neighboring counties. We have over 5 to 6 counties that rely on our COVID healthcare facilities.